So one of the conditions that we've had here is called uterine synec. Uterine synec is a very rare complication that involves the healing and sticking together of the lining of the uterus or the womb. So we mainly have it in women who have had repeated infections of the womb or the uterus, or women who have had procedures, mainly evacuations, or commonly known as cleaning of the uterus. It has been done several times, and infection set in. The uterine lining can heal and stick together. And then also women who have had some surgical operations being done on the uterus can also cause healing and sticking together of the uterus. Mainly these women usually present with chronic pain, what we call chronic pelvic pain, that does not respond to treatment. They may also notice a reduction in the blood flow that comes during their menstrual period. But most importantly, these women are usually unable to conceive because the uterus has healed and stuck together. Yes, and the challenge that we have mainly with this condition is making a diagnosis. So you've seen most of our patients here can't access the diagnostic modalities. It's quite often not picked on ultrasound. So for our setting here at Lira University, we have what we call a hysterosalpingogram, where it's a special X-ray that we use to detect the inner lining of the uterus, whether it's healing together or not. And in terms of treatment, of course, the best modality of treatment is hysteroscopy, which is a camera that we insert inside the uterus to break the adhesions or to open the inner lining of the uterus. And after that, we usually put some device or balloon inside the uterus to stop it from healing back together. Yes. If the blood fails to come, or it reduces in amount because the surface, the lining of the uterus, the inside part of the uterus is stuck together, stuck on each other. So it reduces the volume or the space within the uterus where the blood is supposed to come from.
Lira University is a public university that has a teaching hospital. The only public university with a teaching hospital that is offering many services. The teaching hospital has many mandates. One of the mandates is to teach in biomedical sciences and offer health services to the community, as well as do research and community services. We have organized a camp following our community outreach programs that we've discovered many mothers are coming to our community service outreach programs with complaints or situations that affect maternal and child health services. And most of them have reported previously, as we went to the camp or to the community services, that they need these services, cervical cancer screening, or services of family planning, post-abortion care, and then postnatal care, and then HIV care and HIV test and services, nutritional assessment, and many other services, including many came with prolapse and then fistula. And we saw this as a gap in the services of health service to the public in Uganda. And unlike many other camps that have taken place previously in this country, you hear of surgical camps, you hear of medical camps, you hear of cardiac camps, and many other camps. We realized that there was never before a camp that specifically focused on the mother and the child. And we realized that most mothers are in need of services, antenatal, family planning, cervical cancer screening, post-abortion care, and HIV, and so on and so forth. So Lira University Hospital, together with the Faculty of Nursing and Midwifery, organized this camp, which is going to be free of charge, running from the 15th to the 17th. I must say that even if the camp is from 15th to 17th, from Monday the 13th, we started receiving many patients coming. Over 200 came, and of the 200, about 162 already have been screened, and others have already received services, treatment, investigation. There is a list we have already been prepared who require surgeries. And this camp is free of charge.
Lira University was established by an Act of Parliament in 2015 to be part of the post-war transformation of northern Uganda, and indeed to handle broken people, broken bodies, broken spirits, broken souls. And this is what we are here to bring healing to mothers, to children in different ways. And we want to thank the government of Uganda very much for allowing the university to be established here, especially President Yoweri Museveni for allowing this university to be established in Lira here. So during this camp, there'll be many things that will be happening. Ultimately, people are going to walk out of this place touched, healed, encouraged, transformed.
I am Anna Grace Auma, a senior lecturer in the Department of Midwifery and the Dean Faculty of Nursing and Midwifery. I lead the faculty as the faculty head, but at the same time I also lead a project called the Center for International Reproductive Health Training that is meant to provide pre-service training to the students, provide in-service training to clinical staff and mentors and preceptors, also provide support to clinical services and research. The Center for International Reproductive Health Training was entered a partnership with Lira University in 2021, and since then we have had a number of activities implemented at the university and outside the university. It is in partnership with Lira University and Lira Regional Referral Hospital. As of today, the event for the Sexual Reproductive Health Camp is fully funded by the Center for International Reproductive Health, which is based at the University of Michigan in the USA. The funders have thought it wise that this camp should be able to reach the marginalized and the underserved population of Lango sub-region and give them the services that they need, especially in the areas of sexual and reproductive health. And that is why the Faculty of Nursing and Midwifery, in partnership with the Lira University Hospital, have decided to organize this camp, which will run up to Friday this week.